Assalamualaikum warahmatullahi wabarakatuh and good evening. Today I will briefly describe about flowchart on diagnostic algorithm of cytomegalovirus infection in infants. Okay, I'm Dr. Zaituna Fidiati binti Sarmuna Eliza Ayub from Department of Medical Microbiology and Parasitology, School of Medical Sciences, University Science Malaysia, Kota Baru, Kelantan. Okay, we discuss about this topic. Cytomegalovirus is a double-stranded DNA virus under family of Herpesviridae. Modes of transmission of this virus are via urine and saliva of young children, sexual contact, blood transfusion, organ donation, during pregnancy or vertical transmission and breastfeeding. Infants refer to children from birth up to 12 months of age. Congenital CMV infection and infection acquired during pregnancy can be distinguished via molecular detection of CMV DNA within 3 weeks of life. Positive CMV DNA within 3 weeks of life suggestive of congenital CMV infection. However, congenital CMV infection can't be ruled out if the CMV DNA PCR was done after 3 weeks of life. First serum sample of CMV, IgM and IgG were obtained from the infants clinically suspicious of CMV infection. If IgM and IgG are reactive, plasma sample for CMV viral load is requested together with the maternal serological sample. And that if CMV DNA is positive, we check whether the sample is taken within 3 weeks of life, means that it is congenital CMV infection, or taken after 3 weeks of life. If the second sample was taken after 3 weeks of life, still congenital CMV infection can't be excluded. Next, we see if the IgM is non-reactive, but IgG is reactive. We require second sample at 2 to 4 weeks interval. If the IgM become reactive, means that there is evidence of seroconversion. Okay, it's possible that the patient is having acute CMV infection. The next scenario, if the IgM is non-reactive and IgG is intermediate in the first sample, in the second sample, at 2 to 4 weeks interval, the IgG become reactive. This is also evidence of seroconversion, means that the patient is having acute CMV infection. In the next scenario, the IgM is reactive and IgG is non-reactive. For the first sample, at 2 to 4 weeks interval sample, the IgG become reactive from non-reactive. This also means evidence of seroconversion, means that the patient is having acute CMV infection. Okay. For passive immunity, means that the patient or infants having intermediate or reactive CMV IgG, but no evidence of seroconversion, negative CMV DNA PCR with maternal IgG positive. Okay. For inconclusive, means that the infant serum is seropositive but no maternal sample sent. Okay. No evidence of seroconversion, negative CMV DNA PCR. Okay. And that's all. In conclusion, diagnosis of acute CMV infection in infants can be established either by serological evidence of seroconversion or detection of CMV DNA. Passive immunity means that the infant had positive CMV IgG without evidence of seroconversion in PET sample with no CMV DNA detected but with positive maternal CMV IgG, as maternal IgG can cross placenta. Infants' results that did not meet the above criteria were regarded as inconclusive. So I would like to acknowledge a research university grant, University Science Malaysia, with number of 1001/PPSP/80012293, okay, for their grant, okay, as we can proceed with this research. Thank you.